Audio Jungle.
More on health. No donor lifeline. WHO urges Africa to fund its own health future. The World Health Organization urges African nations to take greater ownership of their health systems by boosting domestic financing and reducing reliance on foreign donors. Speaking at a health financing dialogue in Abuja, WHO's Regional Director for Africa, Professor Mohamed Yacoub Janabi, praised Nigeria's reforms while warning that Africa's health security remains at risk without sustainable local funding.
It was a gathering of health experts, government officials, and civil society leaders brainstorming on how Africa can build a stronger, self-reliant health financing system. At the center of discussion was the World Health Organization, which cautioned that Africa's overdependence on foreign aid leaves its health security vulnerable.
Our sales contribution was up to 20% and sometimes less than 20%. The voluntary contribution is 80% up. So one of the questions I was asking myself, do we really own WHO? Because if it was a business entity, you are the minority shareholder. So to fast forward, the member states, I'm very grateful, we all saw the initiative, the assessed contribution. All the member states have agreed to increase it, hopefully, and wishful by 2030, at least we should reach to the 50%. And the initiatives you are seeing today of member states trying to take ownership of their health, this is the only way we can reach those most vulnerable.
Professor Janabi revealed that the sudden withdrawal of a major donor earlier this year created funding gaps that exposed the continent's fragile reliance on external support. He stressed the urgent need for countries to invest in primary healthcare, applauding Nigeria's ambitious plan to train 120,000 community health workers under its universal health coverage drive. Drawing lessons from the COVID-19 pandemic, Professor Janabi noted that simple preventive measures such as hand washing and mask wearing helped curb infections, emphasizing the importance of smarter investment and collaboration across health, water, sanitation, and the environment.
Today, we in Nigeria, let's talk of Nigeria. The target is to get 120,000 community health workers. Outbreaks starts in the communities and end up in the communities. If we invest on these community health workers, if they pick the signs and symptoms of basic diseases right from the beginning, it will prevent the need of tertiary services. And I will cite a simple example for the time's sake. You have two types of diabetes. Type 1, which is insulin dependent, and type 2, non-insulin dependent. Before you get full-blown type 2 diabetes, you pass through a process which takes about 10 years, from insulin resistance to pre-diabetes. Now, these 10 years, if we integrate the NCDs to the primary health, I can pick high blood sugar. High blood sugar and diabetes, these are two different things. What will I do? Just change your lifestyle. Pick what you eat. So I think for me, and I can say for WHO, the primary health care is a backbone for our continent. And I think if we invest properly, spend smartly, and when we do surveillance, we should expand it. We do surveillance on humans. What about the animals? What about the forests?
Meanwhile, Senator Ipalibo Banigo, chair of the Senate Committee on Health, and the permanent secretary at the Federal Ministry of Health, Dajum Kacholum, highlighted initiatives under President Tinubu's Renewed Hope agenda, including the full implementation of the Mandatory Health Insurance Act designed to shield citizens from financial hardship.
I believe that we need to do more to push for legislation that leverages ongoing tax reforms to advance the prioritization of for health financing. And we need to take steps to also encourage you so that you join us in this technical work, so that we have robust evidence to be able to provide the legislation, the framework needed for legislation to push for the provision of health taxes that will increase and benefit not only our revenues, but also be a way to mitigate the outbreaks we're getting.
Health sovereignty is no longer aspirational, it is actionable. And Nigeria is proud to lead this charge. Therefore, let us seize this opportunity to align our fiscal strategies, mobilize domestic and private resources, and build a future where every Nigerian, regardless of income or geography, can access quality healthcare without fear of financial hardship.
Professor Janebi says Africa's health future lies not in donor, advocating that it must fund its own health future. As both reforms are already taking shape, Nigeria is setting an example the continent cannot afford to ignore. Vincent Okushi, QTV News.
Audio Jungle.